The province of Sorsogon is one of the 2 provinces in the Bicol region designated as a universal healthcare integration site. Its main commitment is to strengthen the provincial health system by establishing a functional health network and excellent facilities while ensuring that every resident has access to quality healthcare services. This includes a responsive, accessible, and comprehensive service without causing financial burden, making it affordable for every Sorsoganon. This also aligns with the province's local 7K development agenda, which addresses Sorsogon's multi-sectoral concerns on kalikasan, kabuhayan, kagandahan, katrankilohan, kalinigan, kadunungan, and kalusugan. Jhpiego, through the MSD for Mothers project, supports the national objective for health and the universal healthcare domains, which encompass functional networks, coordinated primary care, operational management, and health facility centers of excellence.
Through the entrance ng ating partner na Jhpiego, nakita po natin yung development as per the policies na meron po tayo. Mas nakascale. Given that our political leaders have the initiative to push through with the policies and the funding for these projects. Pero mas nakita po natin din na with the presence of Jhpiego, mas na-fast track din po itong mga polisiya na ito na inilalaban po natin sa probinsya. And with that, nakita po natin na mas naging focus or isa sa mga naging priority programs ng ating probinsya when it comes to health ay ang ating maternal and neonatal care.
The MSD for Mothers project works with 18 public and private health facilities in the province of Sorsogon. The project focuses on bolstering emergency response capabilities in health centers and hospitals, while also establishing an effective and efficient referral process for maternal emergencies. Its primary goal is to reduce maternal and newborn mortality rates by enhancing the quality of maternal and newborn care across these networked facilities. The Service Partners Agreement establishes an effective referral system, solidifying shared goals, roles, and responsibilities of the healthcare providers network to deliver quality care.
There is an improvement when it comes to the referral, initially on the referral of our patients. So finally, meron na tayo ng defined rules on where and when to refer our high-risk na maternal cases and even the neonatal na cases. So, apart from that, nakita din natin yung improvement as for the service delivery ng ating healthcare workers, not only inside the hospitals, but more importantly, to the healthcare workers natin on the ground sa ating grassroots level sa lying-ins ng bawat munisipyo na meron tayo sa probinsya. So, through the different capacity training or capacity building na trainings, nakita po natin na somehow malayo-layo na po tayo from where we started. And we can see that our healthcare workers are capacitated enough to render healthcare services, particularly those na mga nasa high risk na maternal cases po natin and neonatal cases.
Yung mga health worker natin, dahil sa sunod-sunod po na nagkandak ng pa-training, mas lalo pong tumaas yung moral ng mga health worker natin kasi nadagdagan po yung kaalaman nila about sa kung paano yung monitoring, pagkatapos yung mga referral natin from RHUs going to nearest facility like infirmary and district hospital going to Sorsogon Provincial Hospital, mas kumbaga wala na yung bulaga system na sinasabi namin na at least bago man lang dumating yung pasyente, na itawag na i-refer na sa group chat And at the same time, nare-ready na rin po kung ano yung mga dapat namin gawin kasi may parating na po na pasyente.
As to yung management naman ng mga maternal patients, maternal tsaka mga newborn, sa ngayon okay naman kasi meron kaming dito, maayos naman na referral system. So pagka halimbawa nakita namin yung isang patient dito na hindi namin kaya ma-manage, pwede po namin siyang i-refer sa higher facility, no. Nataon ngayon, merong malapit na district hospital dyan. So, doon po namin nire-refer. In turn, pag nakita nila na hindi naman nila kaya doon, nire-refer din po nila sa next level facility, which is the provincial hospital.
During the maternal and neonatal death review, most causes of death are attributed to the 3 delays model, which may hinder women from accessing the maternal care they need. These delays are identified as follows. 1. Delay in making the decision to seek medical care. 2. Delay in identifying and reaching the appropriate facility. And 3. Delay in receiving appropriate and adequate care at the health facility.
Nung first time kong dumating dito sa RHU, that time, uso yung maternal deaths. Ano yata yun? 2001, 2002, meron kami mga 11 to 12 deaths per year. At kahit yata sa buong Sorsogon is mataas din yung maternal death noon. Medyo challenging kasi ang daming nanganganak sa hilot. Maraming mga hilot dito noon na nagpapaanak sa bahay. Na kahit na meron ng ordinance na bawal magpaanak sa bahay, karamihan pa din ng mga buntis gusto pa rin sa bahay. So yun ang winwork up namin. Talagang nagkumbinsi kami, nag-IEC sa mga mothers. Gawa kami ng mga buntis congress, ng mga bench, yung mga mothers class, para ma-convince sila na mas safe na magpaanak dito sa facility. So, nakita naman nila na maganda naman yung services namin dito sa RHU, lying in. So, unti-unti, dito na sila nagpapaanak, kung hindi man dito sa hospital, at hanggang sa maka-achieve kami ng 100% na facility-based delivery.
Following the quality standard on maternal and newborn care eventually makes a remarkable impact. A significant decrease in maternal mortality ratio was observed in 2022. Additionally, there was a decrease in neonatal mortality during the same period, but the most crucial impact lies in the empowerment of health service providers, as they acquire the skills and knowledge to identify and manage maternal and newborn emergencies.
Nagkaroon ng coordination with NGOs na nagkaroon sila ng tulong sa Sorsogon Provincial or to the province of Sorsogon for that cases, though not eradicated totally, but at least ma-decrease. Okay? So, actually, we have a decreased cases of mortalities. Though, nung pandemic, which expected naman, since patients, takot sila na magpa-check up sa mga hospitals, nagkaroon ng increased cases of maternal mortalities and even morbidities.
In the year 2022, so nakita po natin na meron ulit ng downward projection sa ating maternal deaths, from which umabot po ito sa, bumalik tayo sa line of 8. And the status quo ngayong 2023 po, for the first 2 quarters, nakita po natin na mababa po yung progression natin in comparison with the previous years na almost more than 10 ang nakukuha po nila na per quarter na maternal deaths. So right now, the status quo po for the past 6 months, almost less than 10 po ang nakukuha natin per quarter. So we're hoping na magiging tuloy-tuloy po ito in the next years and the next decades to come through the enhanced na maternal and neonatal care na service delivery po na meron ng Sorsogon Province.
We saw that the main causes of maternal death in the province remains the top three the top three, such as the hypertension, postpartum hemorrhage, and preterm labor for our neonatal deaths. So, yon. So from there, we started our trainings to help lower the cases of these morbidities and mortalities for our mothers.
Health service providers are trained in taking care of pregnant women and high-risk management, as well as essential intrapartum and newborn care with basic resuscitation.
The topics that were discussed with the Jhpiego training were all on point, on context, on what we needed the most towards a proper and a good maternal outcome in our hospital. I really appreciate that we have already improved trainings towards the proper maternal care, addressing the basic newborn resuscitation and then the postpartum and the proper assessment of patient in labor.
Nalaman ko po ngayon sa training is more on management ng mga nag-labor na mother and newborn resuscitation po sa newborn. Ang sa management po ng sa labor is yung pag-prepare sa mother during labor, before labor, prenatal, and postpartum care po namin. Then sa newborn po, yung mga newborn care po namin. Then ma-apply ko po siya sa hospital namin since nurse po ako, nagpe-prenatal po kami. Ma-advisean po namin yung mga OBs namin kung ano yung mga pwedeng laboratory, pwedeng gawin po nila before pumunta po sa hospital or sa mga line-in clinic po. Ang pinaka-importante po kasi sa OB sa amin ngayon, lalo sa district namin, is yung prenatal po. Then, siguro sa newborn po, kung paano nila alagaan yung babies nila pagdating na din sa bahay. Sa institusyon namin, makaka-help po kami, makakaturo, then mamamanage po namin muna siya bago po kami magta-transfer ng SPH.
3 hospitals have been provided with CTG machines, and 18 facilities have received OB emergency kits and newborn resuscitators.
So, sa nangyari ngayon, dumating yung Jhpiego, nagbigay po ng CTG machine sa Irusin District Hospital, and at the same time po, nagkandak po ng sunod-sunod po na pa-training and pumunta sila dito, nagturo kung paano titingnan, kung paano i-refer sa mga OB-GYN natin na pag ganito na ang lumalabas dun sa machine, dapat mai-refer na agad para maiwasan yung mga complication ng mga mga nagbubuntis.
This partnership with the Sorsogon Provincial Health Office and Sorsogon LGUs has strengthened health service capacities to respond to emergency maternal cases through early recognition of high-risk and complicated pregnancies, knowing when and where to refer the mother, and providing primary care management. The publication of the Healthcare Blue Book, titled Primary Care Management and Algorithms of Common Emergency Maternal Mortality and Morbidity Cases in Sorsogon Province, is also one of the significant milestones in reducing maternal and newborn deaths in the province. It's the first manual of its kind, locally developed and published based on clinical practice guidelines in obstetrics.
Together with our senior OB consultant, Dr. Cagayan, we were able to come up with the Blue Book that comprised of the top 3 morbidity and mortality causes in the province of Sorsogon. So the main goal of this Blue Book is, as the WHO said, that no mother should die of pregnancy and childbirth. So we are one with the WHO, with Jhpiego and the Provincial Health Office to improve and to reach that zero maternal mortality goal. So for this Blue Book na nagawa because of the Jhpiego and the coordination of our local consultant and senior consultant, nagawa po siya not only for us, but most especially for the end users, which are the midwives, nurses, doctors, na nasa RHUs, lying-ins, even sa private lying-ins, they're also included in this endeavor. Because of that Blue Book, there are the management na kailangan po nilang gamitin na i-practice for this increasing, or sabi natin, hindi naman siya increasing, though bumaba na siya eh. Kaya lang sabi nga natin, at least ma-zero natin yung cases na yon. So, because of this, yung mga management na naandun, sana magamit ng mga end users natin. For the Jhpiego and MSD for mothers, they are our donors for this ginawa naming Blue Book, for this endeavor, para naman makatulong tayo sa mga recipients natin, lalo na sa mga mothers na nangangailangan ng tulong. Kasi sila yung dapat na makakuha ng mga naging na narration skills ng ating mga health workers. So, thank you very much po sa inyo, not only for these skills, and also for the materials that they've given, the CTG machine and everything, even the medicines, the initial medicines they're given. Thank you so much po.
Through the concerted efforts of the Provincial Health Office, LGUs, health facilities, local agencies, CSOs, and development partners, all working harmoniously, Sorsogon is making remarkable progress in providing universal healthcare that is accessible, available, affordable, and of high quality to its residents. Creating a world where no woman has to die while giving life.